Okay. So over that time period, obviously you've seen hundreds, like I said, if not thousands of injuries to the knee. We're going to talk specifically about the anterior cruciate ligament. Can you just give us a little background about why is this ligament so important? Maybe a little basic overview of the anatomy as to what we're looking at here.
Well, again, if you look at things, in sports-related injuries, the number one joint injured is the ankle, but the knee is probably more important.
Okay.
And with bigger, stronger, faster athletes, both men and women, and really more people participating in sports, they need their knees. And the anterior cruciate ligament is the sort of the major stabilizer of the knee. Now, if we can look at, you have this will help things, but we're looking at a knee here, and if you can take a look, the femoral condyles here, the femur, this is the femur of the thigh bone, they're not even, all right? So when the knee goes through flexion and extension, if it is a fixed fulcrum, the femur will rotate back off of the tibia. Watch that, see that?
Mm-hmm.
So what does the anterior cruciate ligament do? It is the stabilizer that as the knee flexes, it pulls the femur forward or the tibia backwards and makes the femur slide and stay centralized on the tibial plateau.
We're looking at this structure right here, correct?
The structure is the structure in the front right here. And the structure goes from the anterior aspect of the tibia to the posterior aspect of the femur. So that's its main job. It also helps both stability this way. So what it's doing is, with the quadriceps, hamstrings, calf muscles, all the muscles that motor it, it's holding the knee together as these muscles work to propel the athlete forward or backwards.
Okay. What is the common mechanism of injury to this particular ligament? What normally happens when someone injures their ACL?
There's three mechanisms really. It's basically a deacceleration injury. Again, acceleration gets you going, and it's just like in a car. Think about deacceleration gets you going. All of a sudden, you put on the brakes, right? What are you thrown forward dramatically? So it's a deacceleration injury where when you land or your foot is planted, you now have to flex the knee to control yourself, but you also have rotation or torque, twist. So it's deacceleration, slowing down, flexion, and torque. Mm-hmm. This can occur when you're running fast towards the sideline, suddenly planting your foot, or a lot of times it's landing from a jump. Mm-hmm. The other mechanism, less common, is a sudden hyperextension injury, where you'll tear more of the proximal aspect or the upper aspect off the femur. The deacceleration injury is more of a central injury that's spiral. It rotates through it. Mm-hmm. But once the ACL has flexibility, so it can sort of stretch out about 15% of its length, but once it goes past that stretch, it now starts to rupture or tear, and it goes quickly. It's like a millisecond, it ruptures.
Mm-hmm.